What's up, guys? Tiffany Robinson here from Beyond RCM Revenue Cycle Management here in New York State. And I am so excited to be putting out this latest video. I'm really excited because we did a Q&A session last month where we addressed a couple comments that came in on previous videos, and we decided to expound on them in a video. And I'm going to bring you another Q&A session today, so I am super excited. But before I delve into these questions, I just want to give a little background about our YouTube channel in case we have any first-time viewers. So Beyond RCM is a YouTube channel that is geared towards inspiring aspiring medical billers, encoders, CDI professionals, etc. Individuals who are looking to break into the industry and are trying to navigate, what program should I sign up for? What are some best tips to land my first position? How do I navigate landing my first position? All of these things are topics that we delve into on this YouTube channel. And just so you know a little bit about me, well, you already know my name because I introduced myself, but I have worked in the healthcare industry for 25 years. I started out as a medical biller encoder and gradually worked my way up. Currently, I am a director of revenue cycle management for a private organization, and I've also obtained certifications in healthcare compliance and clinical documentation. So I know what it's like to start out as a newbie and want to get in the door and having doors slammed in my face and being persistent. And I also know what it is like to mentor and help individuals who are trying to get their start. And that's what Beyond RCM really is. I've mentored many people throughout my career, but Beyond RCM allows me to be a mentor on a global scale. So that's really exciting because I do get messages from not only aspiring MBCs here in the States, but I also get questions from people in other countries, which I find to be fabulous that I'm able to connect with individuals on a global scale. So that's exciting. And if you haven't done so already, don't forget to like, subscribe, and hit the notification bell so that every time we put out new content, you will be one of the first to know. So let's delve into the questions that we have. So the first question came to me, and this is actually from one of my mentees, Jane. Hey, MJ. So MJ reached out to me wanting to know if AMCA is a good organization to get certified through. And MJ, as you know, when you messaged me, I mentioned that I wasn't familiar with AMCA. I asked you to send me the information for them, and I would do some research and get back to you. Now, I know you sent me this question a couple weeks ago, MJ, so I'm sorry, but look, I did a video. Do you forgive me? So I did research this company, this organization a little bit, and AMCA stands for American Medical Certification Association. I did review their website, which is amcaexams.com. And I am assuming that the program that you are looking to sign up for is the Medical Coder and Biller Certification Program, the MCBC. So a couple things that I noticed from what I saw on the website link that you sent, it looks like this is more of like a testing organization that they gear towards providing certification exams for different medical professions. Medical billing and coding happens to be one of those professions that they provide exams for. I did not necessarily see anything that showed a program that helps you prepare for the exam. Typically, when you are sitting any type of exam, you want to have some type of course that you can prepare, that you can study, that you can get a more in-depth knowledge of what it is you're going to be sitting a certification exam for. And I did not see that on the website. I saw the exams, the course outline of the exams, what information would be covered on the exams, which the information that they cover are pretty standard for a medical billing and coding exam. And when I looked to see some of like their testimonials, so what other people had to say about the organization, a lot of the feedback had to do with how easy the testing was, how accessible the test site was, how friendly the people were. I didn't see anything that talked about they did a great job preparing me for my exam, I was able to pass, or I was able to land my first job because of my certification and experience with AMCA. So I, unfortunately, in good conscience, can't endorse this organization. I feel like it's more of a testing organization. And before you take any type of exam, and you know this from my experience, MJ, before you take any type of exam, you need to make sure that you have adequate preparation. The other thing I will point out, and I always use this as kind of like a compass to individuals who ask me what programs they should enroll in, because sometimes you find these smaller schools and their prices are very reasonable. But the tip that I always give is go and research some of the jobs that you're looking for. What kind of job are you trying to land after you obtain this certification? Go online, go look now and see the type of job that you would like to land and see what their requirements are for certification. That will give you a good idea as to what the standard is in terms of what entity those organizations want to see that you are certified through. So I hope that answers your question, Mary Jane, in great detail about AMCA. I wish I could give them a gold star, but it seems like it's more of a testing site, and I would have liked to see more information about how they're going to prepare you for the test. And I would have also liked to see more information from individuals who have gone through this organization and have found success with them. But best of luck to you, MJ, in your educational journey, and feel free to send me any additional questions. If there are any other organizations that you come across and you want some input, please feel free to holla at your girl. Okay. So my next question comes to one of the channel's faithful viewers, Vicky at V Marie Gold. How are you, Vicky? I'm sending you lots of love. I read your last comment. Hang in there. Don't be discouraged. Get up, dust yourself off, and get back out there. So, Vicky, you sent a pretty cool question. And your question was, is AAPC CDI certification different or better than AHIMA's version? Ooh, Vicky trying to get me in trouble. Okay, so as many of you who've been watching and following the channel know, I am certified through AHIMA and AAPC. So I do more volunteer work through AAPC. I'm a chapter officer through AAPC. But a big part of the reason why I tend to volunteer my time more with AAPC is because AHIMA doesn't have a tremendous amount of local grassroots, and AAPC does a great job of having chapters in different parts of New York where we can meet on a consistent basis, etc. But if AHIMA did that, I would love to be a part of it because I've actually been certified through AHIMA longer. So I went and did some research because the last time that I reviewed AHIMA's outline for and the exam that they have is the CDIP, so the Certified Documentation Integrity Practitioner Certification. So I had looked at that program in 2019 when I started embarking on wanting to become certified in clinical documentation. And at that time, I decided not to go with AHIMA because they didn't have an adequate program, I felt, to help me prepare for that exam. That is no longer the case. So I went back in to look at their course outline, and I am very pleased to see that AHIMA has done two things. They have moved a lot of their tests to online, which to me, that wasn't really a deal breaker because when I took my exam with them years ago, I went to a testing site. It was on a computer. It was proctored. I got my results the same day. I had a great experience testing with them. Where I struggled a bit, and I think I talked about this in earlier videos, was I felt that there wasn't an adequate program to help me prepare for my exam. And I had to create kind of my own program, which if they would have had a program, I think it would have helped tremendously. But they now do. So that is super exciting. I was super excited to see on their website that for these different certification programs, not only are they offering online testing, proctor testing, but they have programs to help you prepare. So that was great. I did see, however, that they do have certain requirements. So for example, in order to do the CDIP, you need to have a 2-year degree or higher, or you need to have a CCS, CCSP, RHIT, or RHIA certification. So Vicky, you want to pay attention to that to see if you fall into that criteria. And what I did like about AHIMA was that it was more cost effective. So their certification program and the actual exam was definitely more cost effective than AAPC's. And they cover very similar domains. I looked at the different domains that they cover in the program and on the test, and it is comparable to the CDEO. The only thing I will say is it looks like the AHIMA's program combines both inpatient and outpatient under the CDIP certification, whereas with AAPC, they have a separate exam for clinical documentation in an inpatient setting versus clinical documentation in an outpatient setting. So I'm not sure if by them combining it, how they address I'm sure they do a great job. AHIMA is one of the leading organizations in the industry. So I don't think that that's a tremendous deal breaker. But I will say, Vicky, that you will, if you are looking for a more cost-effective option, then AHIMA is definitely the program that you want to go with. I do see that they have a course that prepares you now for the exam. So and as a AHIMA member for over a decade, almost 2 decades, wow. As an AHIMA member, I want to see these things. Those were my biggest gripes. If you looked at my previous videos, my biggest gripes were they don't have enough programs to prepare you, and they have now addressed that. And they're more cost effective. So I have no problem. AHIMA is a well-respected organization in the industry. So if you are looking to save money, then I would say that you probably want to go to AHIMA. And I'm going to tell you again, don't be discouraged. You get down, you fall down, you get back up, you try again, keep at it. And if you have any other questions, Vicky, regarding your clinical documentation journey, please feel free to reach out with a comment, and I will definitely include it in another upcoming Q&A session. And that's not just for Vicky and MJ. If any of you are checking out this channel and you have questions about your career journey related to this, as it relates to this field, drop us a comment. We will definitely address it in a future Q&A session. And that is pretty much it. I'm wrapping up today's Q&A session. Thank you so much for joining me. I hope you found this information to be helpful. Again, if this is your first time, please do not forget to like, subscribe, and hit the notification bell so that you get future content. Thank you so much for spending your time with me today, your 14 minutes with me today. I appreciate it. Again, my name is Tiffany Robinson. I get the honor of being the owner, the founder of this amazing organization where we get to give back to newbies. We will see you in the next video. Bye.